Welcome to this unit on artificial intelligence in healthcare. By the end of this unit, you will be able to outline the use of artificial intelligence, or AI, in healthcare. AI in healthcare. The use of AI in medicine raises notions of AI replacing clinicians and human decision-making. However, the prevailing view is that AI is increasingly improving diagnosis and clinical care. Diagnosis and prediction-based diagnosis. AI can support diagnosis in several ways, including radiology and medical imaging. These applications are relatively novel, and AI is not yet routinely used in clinical decision-making. AI is currently being evaluated for use in radiological diagnosis in oncology, such as abdominal and pelvic imaging, colonoscopy, and mammography. Non-radiological application, such as dermatology and pathology, diagnosis of diabetic retinopathy, ophthalmology, and for RNA and DNA sequencing to guide immunotherapy. In low and middle-income countries, for example, AI may be used to improve detection of tuberculosis in a support system for interpreting staining images, or scan X-rays for signs of tuberculosis, COVID-19, or other conditions. However, few of these systems have been evaluated in prospective clinical trials. As AI improves, it could allow medical providers to make faster, more accurate diagnoses. For example, for the prompt detection of conditions such as stroke, pneumonia, and breast cancer by imaging, coronary heart disease by echocardiography, or detection of cervical cancer. AI could be used to support low-income settings where there are chronic shortages of healthcare services and skilled workers by providing assistance in diagnosis and assessment, and thereby reducing workload on healthcare workers. AI also has the potential to predict illness or major health events before they occur. AI systems can support prevention research through analyzing large amounts of data to identify patterns which can enable the prediction of probable trends. For example, AI could be adapted to assess the relative risk of disease, which could help prevent lifestyle diseases such as cardiovascular disease and diabetes. It could be used to identify individuals with tuberculosis in low and middle-income countries who are not reached by the healthcare system and therefore do not know their status. Predictive analysis could avert other causes of unnecessary morbidity and mortality in low and middle-income countries, such as birth asphyxia. Questions about the role of AI in health include whether the performance of AI can be generalized and regulated to implementation in practice, whether AI trained for use in one context can be used accurately and safely in a different geographical region or context, mitigating any risk of bias. AI in clinical care. Let's now look at applications of AI in clinical care. Clinicians could use AI to identify patients at risk and vulnerable groups, aid difficult treatment decisions, catch clinical errors. In low and middle-income countries, for example, AI could be used in the management of antiretroviral therapy by predicting resistance to HIV drugs. This could help physicians optimize diagnosis, prognosis, and treatment. However, clinical experience and knowledge about patients is essential. AI will not be a substitute for clinical due diligence for the foreseeable future. If it did, clinicians might engage in automation bias, where the system is trusted based on perceived accuracy and objectivity, without considering whether an AI technology meets their needs or those of the patient. Challenges to AI in clinical care. The wider use of AI in medicine also has technological challenges. Many prototypes have been developed and performed well in field tests, but they often cannot be translated, commercialized, or deployed. AI task automation could give doctors more time to listen to patients, address their fears and concerns, ask about unrelated social factors. However, it could also lead to an economically driven approach to healthcare, resulting in patient inequities. For example, using AI for task automation may lead to a reduction in the number of staff required, negating the potential increase in doctor-patient time or reducing human contact services in some areas. As the use of AI increases, healthcare workers will also have to adapt their clinical practice. Doctors will have to update their competence to understand how AI functions, communicate risks, make predictions, and discuss trade-offs with patients, express their ethical and legal concerns about AI technology. Additional obstacles for health administration are the ongoing changes in information technology management, whereby systems become obsolete, the challenge of training staff to use new technologies, the lack of digital infrastructure in resource-poor countries, which limit use of such technologies. You have now completed Unit 1 of Module 1, Applications of Artificial Intelligence for Health. In the next unit, we will look at emerging trends in the use of AI for health.